Again, greetings, welcome. I think most of you know me by now, but Clarence Braddock, Vice Dean for Education, and I've been your tour guide on this journey from a year ago when you were first applying to now you're just about to start your journey as a medical student at the David Geffen School of Medicine. We couldn't be more excited and delighted to welcome you all here and to welcome you to this town hall. A brief overview of what we'll do today. We're going to do some upfront, some introductions, some welcomes. We have our Dean, Dean Kelsey Martin, here to offer a greeting in a second. Then I'll introduce our key other leaders in our team to say a few words, and then we'll start to go into the kind of questions and things we think are top of mind, including many questions you've had about the curriculum and COVID and such. But then we'll have plenty of time after that for a question and answer, whatever other questions are on your mind. We have an entire team here ready to answer those questions for you. The session is being recorded, so if you have to drop off or you have a friend or someone who missed it, we'll have that available for you. With no further ado, I'm delighted to welcome Dean Kelsey Martin, who's delighted to be here to offer you her welcome. Dean Martin.
Yeah, thank you, Dr. Braddock, and welcome to everybody. It's really, I'm smiling looking at all of the names of the participants, and I want to welcome all of you. I'm so excited that you're going to be starting in less than 2 weeks. You're entering a profession right now that needs you more than ever. I think we're looking at the pandemic that's turned our world upside down. We're looking at issues of social justice and health disparities, and you are the hope for solving those problems that are the problems that are really at the heart of humanity. And I know, because you're all coming to the David Geffen School of Medicine, that you're all those individuals who are going to have an impact, because you're all going to be physicians and leaders in medicine, and we are really here to support you in achieving those dreams and really having that impact. We also want to make sure that you are safe. We completely understand the stress that everybody is under right now, and you'll hear a lot more about what the curriculum will look like. We evaluate this on a daily, if not an hourly basis, to make sure that everything is in place to ensure that you're safe and that you're going to be able to learn what you need to learn, and that you're going to be physically safe but also mentally safe, and that you're going to be able to take care of yourselves and take care of each other as well. We in the David Geffen School of Medicine, we have a sort of a playbook or a framework called the Cultural North Star, where we do what's right, we make things better, and we are kind, we be kind. And, I think for all of us, as we work with you during your time at the David Geffen School of Medicine, I hope that North Star will guide the way that we interact with you, that we make decisions, and that we engage in dialogue as is needed during your education. And so with that, I'm going to turn it right back over to you, Dr. Braddock.
Thank you, Dean Martin. Again, really appreciate your support, your being here to welcome the students. We'll be welcoming you a few more times over the coming weeks. Before I turn to some other introductions, again, I just want to acknowledge that, as Dean Martin said, this is kind of a very extraordinary time. Obviously, the pandemic and how that's impacted all of our lives. Some very direct. I know some of you may have folks in your lives who have been directly affected by the COVID-19, but certainly has affected everything about our lives. And we have been and remain pledged to do two things: to try to advance your journey to become physicians, and while at the same time being very mindful of our individual and collective public health imperative to behave in everything we do in a way that it helps contribute to efforts to contain the pandemic. So that's been forefront in our minds all along. I'll come back to talking about that a little bit more detail in a few moments. Next, I'd delighted to introduce Dr. Lee Miller, our Associate Dean for Student Affairs, to say a few welcome remarks, and I'll introduce, I'm not going to introduce everybody, but I'll introduce our Associate Deans and let them say a few welcome remarks. Dr. Miller.
All right, thank you so much. I would just really like to add my warm welcome to that of Doctors Martin and Braddock. And I want you folks to know that there are so many of us, including faculty, deans, and many staff members who have been working so hard to prepare for the start of school. And as Dr. Napolitano and I mentioned in our email message to you earlier this week, your class is really amazing, and it includes students in our Drew UCLA Medical Education Program, our Prime LA program, and our MSTP MD PhD program. And together, you folks are all about to embark an incredible journey starting 10 days from now to becoming physician leaders. And during intro to the profession, we'll have opportunities to connect more. And over the weeks, we'll need to be creative about setting up ways in which we could connect individually to get to know one another better. And that's very, very important to me. For now, though, I just want to highlight a couple of things. And first is our societies, a major component of our longitudinal advising program. We have a fantastic cohort of society deans who, along with the rest of us in the dean's office, will be supporting you so much over the years ahead. And some quick introductions. First, leading the Utila Society is Dr. Ilgi Fitzgerald. Ilgi, if you can give a wave to folks there. And Levamentum Society, Dr. Deb Lehman. There's Deb. And the Accendo Society, Dr. Holly Middlecoff. And our newest society dean leading the Caritas Society, Dr. Chandra Smart. There you are. All right. I'd also like to introduce you to Dr. Karen Miyota. Karen, are you there? You are. If you can give a quick wave. Dr. Miyota is the director of our Behavioral Wellness Center, and I will have lots to share with you about the importance of taking great care of yourselves, and that absolutely includes your emotional well-being. And I'm very grateful to Dr. Miyota, to Dr. Gillis, who I thought I saw on here before. If she can give if she was on, to give a little wave, and really the entire BWC team. So really, on behalf of all of us in Student Affairs, and there are many of us, and you'll get to know us well over the weeks ahead, a warm welcome to the DGSOM family.
Thanks so much, Dr. Miller, and thanks to all the assistant deans, including Dr. Smart as our newest. I know you've been such a phenomenal force and presence and support for our students, so I want to express my gratitude. Next, just a couple more introductions. So the students, I said students, not applicants. You're students now. I've officially dubbed you as DGSOM med students. I know you haven't started yet technically, but we're gonna act as if. But as you know, over this past year in our work together, I've been interim Dean of Admissions, and I'm delighted to introduce to you our new Dean for Admissions, who you'll get to know as you get to campus, and she'll be, I'm sure, wanting to partner with all of you and helping to continue to refine our approach to the next batch of students. But I'm delighted to briefly introduce Dr. Jennifer Lucero to say a brief hello.
Thank you. Hello. Hello, DGSOM students. I am excited to be here. I am officially here, although virtually up north, but I'm glad to get a chance to meet you. I'll be doing some sessions with you on your first week, so I'll get the chance to interact with you, albeit virtually, but I'm excited, and we're both going to be doing this, entering this institution, which is amazing, together. So I'm going to learn from you, and we're going to get through, and again, just to echo what Dean Martin said, we need you, the health system and the field of medicine needs you more than ever. And I'm excited. This is an amazing, and I feel like it was yesterday when I was in your shoes. It wasn't, but it feels like that's what's an exciting time. So welcome, welcome.
Thank you so much. And Dr. Lucero actually just started Monday, but already having a huge impact. We're delighted to have her joining our team. And then third would be our curriculum dean, our associate dean for curricular affairs, Dr. Jason Napolitano, I'll just say a educator supreme, highly decorated. We're very delighted. He's been in the role for a couple of months and will be a key partner of yours in shaping your educational experience for the coming years. So Dr. Napolitano.
Thank you, Dr. Braddock. A warm welcome to everyone, echoing everyone else's thoughts that we're just really excited to get started with this year. The start of this year is going to look a little different from a curriculum standpoint in that it's, has the hybrid nature to it, but that doesn't mean that the education will be, in any way not as good as in previous years. We've been working really close with the faculty to, decide on the right modalities for delivering the curriculum, deciding on what really needs to be delivered in person for you to have a full immersive learning experience. For those, parts of the curriculum that need to be in person, we're going to make sure that the right safety parameters are in place. There's a full, I don't know how many pages the document is, probably 20-page document about safety parameters that need to be followed on UCLA campus. And we've been working with each professor to, change the structure of labs, change the number of people that'll be in a space at a given time to make sure that everybody can get the experience they need to be ready to be the next set of great doctors out there and to take care of all those people that are going to need you, but also doing that in a safe way. I know I'll steal Dr. Braddock's joke. He always jokes around that the safest place in the course of your day will probably be in the anatomy lab. That's probably safer than Whole Foods. And with kind of the plans that are in place, we are thinking that will be the truth. So really excited to get started, have a nice introduction to the profession week planned to start in less than 2 weeks, and looking forward to seeing you both virtually and then at those lab and clinical skills sessions as well.
Thanks so much, Dr. Napolitano. And I will apologize in advance for not introducing everyone. 2 reasons for that. One is I want to get to the substance of our conversation, and also because when you do enter the profession, we will do a much more robust introduction of lots of folks. One other person I do want to introduce before getting to our substance today is Dr. Daphne Calmez, who's Associate Dean at Charles O. Drew College of Medicine and a vital partner of ours in our longstanding joint program, the UCLA Charles Drew Medical Education Program. Dr. Calmez, I think that you're here. You're not on my first screen here, but I know you're there somewhere. Maybe you can say a brief hello. I thought I saw her.
Maybe she got kicked off Zoom.
Yeah. Well, yeah, this is the upside and downside of Zoom. Well, if Dr. Calmez comes back, maybe we'll have a chance to chat. And those of you who are in the Charles Drew program, Dean Martin and I will also see you at your upcoming ceremony for the students in that program. Okay, so let's dive in. So I think probably I'll start with just some comments that cover a lot of the questions, not all of them, but they're sort of a theme around just walking you through our thinking about how we came to hybrid instruction, how we're thinking about COVID, the pandemic, the evolving numbers in Los Angeles County, and what you can expect. So I'll give an overall summary. I might see if Dr. Napolitano wants to, embellish a bit, but then we'll use that as a jumping off point to then go on with your questions. Let's just say, let's go back. So when the pandemic really started to become evident to everyone, there was a lot of conversation nationally around what to do with regard to medical student education. At that juncture, this is late February, early March. A lot of unknowns about the pandemic, its extent, a lot of unknowns about the virus, methods of transmission, which were thought, and even today we know there's still some refined thinking about methods of transmission and hence methods of protection. As that became more evident in the clinical environment in particular, a lot of recognition of the need for enhanced, not to get too technical, but enhanced droplet personal protective equipment, or PPE, and it became recognized, that it was uncertain what the trajectory was of case volumes at our hospitals, in our our hospital, our affiliated hospitals, availability of PPE, et cetera. And so the decision was made in early March that for our clinical students were all temporarily taken out of the clinical environment, and all of our instruction went to remote. Since that time, I think we have all learned a lot. Certainly, we know we're in the midst of a resurgence of COVID, certainly here in Los Angeles County, but many places around the country, if not the world. And we know the factors that lead to that. We've consulted extensively with our own faculty who are experts and lead our infection prevention unit, with the UCLA campus and University of California leaders, with Los Angeles County Department of Public Health officials, and with the state of California Department of Public Health officials. And we've used those conversations to ask ourselves the question, what should be the framework, the principles that around which to structure our education. And the first principle is that we're training physicians, and as such we have a responsibility to do everything we can within reason and within the appropriate boundaries of safety and prudence to continue to train physicians, so we're creating the workforce for the future. That certainly guided our thinking about fourth-year students, so we made sure they all graduated on time. The third-year students who initially were doing everything remote, who were doing no direct patient care, but recently, a few weeks ago, did return back to direct patient care, knowing that we had confidence in all those environments. We could take the steps, including adequacy of PPE, symptom monitoring, et cetera, to assure that we're doing so in a prudent fashion. For first and second year students, obviously as first year students, but also our previously first and now second year students, the question was, how should we think about the pre-clerkship instruction? And there we were guided by really the same thinking that we were guided by in the health system, which is to say we needed to think very carefully about what were essential activities and what were essential, meaning activities that could only be done in the clinical environment. So for example, if a person were coming in for a procedure, a minor or major surgical procedure, they obviously need to physically be present in the hospital or health system setting. But certain kinds of visits, primary care, routine prevention visits, visits in the mental health world can be done remotely. And so what you've seen is an explosion of telehealth, really is a recognition of being very, very intentional about what things we really need to do, they're essential to do in person, versus those things that can be reasonably well done remotely. And that same thinking has informed our education decisions. So in that, we thought very carefully within our team, consulted with our peers at other campuses, as I said, with the UCLA campus, the University of California Office of the President, LA County Department of Public Health officials, including Dr. Barbara Ferrer, and really defined categories of educational activity that it's essential to do that in person. And largely, as you know, that's instruction on the physical examination, anatomy lab, dissection, prosection, et cetera, and certain histopathology and other labs. So we really went through a very intentional process. The next piece was to define how we could do those with appropriate prudence around personal protective equipment. So again, working with infection prevention colleagues, designed a protocol for those sessions to be done in a way that very much mirrors what we do in the clinical environment, with mandatory masking, a variety of sanitation procedures before and after every learning session, physical distancing requirements, symptom monitoring, which you probably learned about, et cetera. And that package of activities has allowed us to define a very defined subset of activities that allow us to do those essential educational activities in a way that's appropriate and is providing appropriate protection. So to echo what Dr. Napolitano said, it's actually going to be a very, very, probably the safest environment you'll be at in a 24-hour day, honestly, except maybe if you're just, by yourself in your apartment. But certainly, I know that as someone who still does clinical work in the hospital, that I felt more safe being in the hospital on rounds than going to Target or Whole Foods, or at least around Westwood, people are being pretty good about wearing their masks. So a number of you have asked questions about, well, the what ifs. So certainly, as the case numbers in Los Angeles County began to creep up again, a lot more concern, apprehension, you might say, amongst everyone around what that means for us individually and as a community. And we've been watching those numbers very carefully, and importantly, continuing to check in with our public health and infection prevention colleagues. And we continue to be confident and committed to moving forward with the plan as we have it. The public health officials have maintained their designation of the subset of activities that we have as essential activities in the training of future healthcare providers, and as such, they fully support what we're doing. The one refined question that I'll address, and I'm going to stop talking a bit to let let Dr. Napolitano add anything he thinks I may have missed, is the question around comparing and contrasting what your experience will be with the second year medical students. So in summary, the second year student program has a lot of similarities to the first year. There are, as you know, in the first 2 years, there are 9 so-called blocks in our human biology and disease sequence. There are 5 in the first year and blocks 6 through 9 in the second year. The concentration of activities that I mentioned, the essential in-person educational activities, is much higher and much more regular and frequent in the first year than it is in the second year. And as such, it made it much more vital for us to have ongoing in-person instruction throughout the first year. In fact, as a sign of that, one of our blocks in the latter half of the first year, the block 4, includes, among other things, musculoskeletal organ system. And it was really impossible to, at that time, do remotely the teaching of the musculoskeletal exam. So we're actually going to be creating some activities for the second year students to kind of have that exposure, so we make sure that they're getting the learning that they need to advance forward. So some of you may have heard that the second year students have a little bit different structure in that they have fewer of the in-person activities, and as such, we are strongly recommending that they be in person for those activities, but we are providing some latitude for the second year students to do the front part of their second year remotely. They will be, in so doing, committing to, on the back end of their second year, towards the end, a concentrated set of activities designed to make that. That just wasn't possible for us to do for the first year curriculum, but is much more possible for the second year. Of note, those students all recognize that they will be giving up something on the back end, and a lot of that will be in the time that they have to prepare for and take step 1 of the licensing exam. So again, that may be a little bit too much in the weeds, but I know a number of folks asked me questions and others questions about that, so I thought it'd be important to address. So with that, I'm going to pause. Before asking Dr. Napolitano to add anything that he might like to, again, we are being very cognizant literally every day, asking ourselves the question, what's happening in our environment, Los Angeles County, in our UCLA health environment, and consulting with all the experts and officials that I mentioned. So I want you to know that we've come to this point with great intention and with a great sense of purpose to make sure that we are advancing your education to eventually become physicians, at the same time doing so in a way that's responsible. So Dr. Napolitano, I don't know if you want to add anything to that.
I just had a couple of things that was great and very comprehensive, Dr. Braddock. Just to compare and contrast the first and second years, thinking about what you're about to embark on as first year students, that time in the anatomy lab is just really critical to formation of young doctors. That's where, many of us really first began to feel like medical students and really, began to learn in depth about the body and the type of work that we'll be doing. With many people being kinesthetic learners, it's just really optimal to be in that lab. And there's many anatomy labs in the first year and many hours spent there, and it's really central to the first year of medical school. Then on the clinical skills side, you sort of have two passes through the organ systems, learning the basic maneuvers and exam techniques in the first year with a little bit of the clinical reasoning at the same time. And then in the second year, really going back through each organ system and layering on the deeper medical decision-making concepts. So that first time that you're going through with clinical skills, it's really key to be hands-on and be getting feedback from a preceptor that's there with you in the room, so you can learn the initial techniques before you learn even more about the cognitive side in the second year, which has a little more potential to be taught virtually. So that's just a little comment on the compare and contrast between first and second years. And then just sort of a big picture thought. I've been on service several times in the hospital in the midst of COVID, and I'll say that the first time that I went into the hospital, just as Dr. Braddock had mentioned, it seemed, really complicated, and to do the symptom tracker and the temperature checks and figure out where, I was getting the mask, et cetera. It sort of made for some stress on that first day, but by the second or third day, it was almost like I've been doing that forever. You really get used to the precautions that need to be taken, and I think once you get immersed in the day-to-day curriculum and see the protections that are in place, I think some of the discomfort that's out there and that's to be expected and is normal, I think a lot of that will start to fade away to some extent.
Yeah, thanks for adding that. And I did think of one other thing I wanted to add that I didn't, which is about the symptom checking that Dr. Napolitano mentioned. So there are a lot of questions about that, and I don't want to go into like gory detail, but overview is that every one of you, every student, every staff member, every faculty member that's going to be in the environment with you will be doing a daily symptom check, and it's a evidence-based strategy to look for a whole host of symptoms that could be the sign that someone has a brewing illness. If anyone who does that, and when you do the symptom checker, and I've been doing it personally all of us have been doing it every day since March, whatever. You check a series of questions. If the answer is no to all those questions, you get a little e-certificate, and it gets sent to a database, so you're cleared. In the case of going to the hospital, cleared to be able to enter the hospital. You go through a little checkpoint. If a person answers yes to one of those symptoms on the symptom tracker, they're put in touch with a hotline, and on the hotline, the person will do further queries to try to understand what your symptoms are and make a recommendation about testing and what, if any, medical care that you might need. And importantly, then, what should be the guidance about returning to the environment, in this case, the learning environment. So you'll be getting, anyone in that situation will be getting very specific guidance. Once testing is done, if there's the testing and contact tracing. So any positive test is always followed up by contact tracing. That is to contact any individual who might have been in the same space with that individual. Because we're bringing you into an environment with PPE, our experts tell us that with symptom monitoring and PPE, the risk plummets in terms of any possibility. Now, what if you, despite all that, obviously you're not just in an anatomy lab, you're also out in town. You have the things that you do in your just day-to-day life are also, quite frankly, the more the things that we all need to be more cautious about. Hence the mandatory masking in public and social distancing, physical distancing in public. But let's say that someone were to wake up one morning with a symptom. it gets captured on the symptom monitoring, but of course you also can report directly to the Student Health Service at ASH, and they have access to testing and contact tracing and such. So there's a number of redundant mechanisms to assure that anyone, whether it's student, faculty, staff, whatever, that has symptoms is not going to come in that environment, and and secondly, will get plugged in to advice and guidance on what they should do, testing and contact tracing. So I just wanted to add that piece. Apologize if that's too much detail, but I know a few people asked about that. Okay, so the rest of our time together is really going to be just your questions. And to do that, I'd invite you to, if you go to the participant panel of the Zoom, you'll see there's a little feature to raise your digital hand. And anyone that has a question can raise their hand, and one of our members of our team, Ashley Seamer, will monitor that, and will call on you to ask your questions of me or really anyone else on the call.
We have our first question. Annette, I see that your hand is up. I'm going to go ahead and unmute you.
Hi, Annette.
Hi, thank you so much for doing this. I just have a question specifically on what happens if someone does test positive and we have to miss anatomy lab. How are we going to make that up?
Sure, great question. I'll start and then I'll let Dr. Napolitano add. But generally speaking, of course, over the course of time, there are times where students have an illness, even pre-COVID, and we have, for each course, each segment has a particular protocol for that once you notify people, it's counted as an excused absence, and then depending on the activity, the faculty member will design the appropriate makeup. But Dr. Napolitano, you want to add anything to that?
Yeah, we're definitely prepared for students that have brief times away from the curriculum. That will happen in regular years with the flu or with minor surgeries that are needed, et cetera. Our block chairs, our anatomy thread chair, doctoring chairs, clinical skills chairs, everyone's been pretty collaborative coming up with makeup work that can be done, while being away from campus. So we have, a good history of being able to pull that off, and we're prepared to do that again. It's not that you'll, have to restart again the next year. We would find a way to get you back up to speed if you miss some time.
Yeah, and I would refer you to there, as you start to look at our regular sort of MD program, policies and such, you'll find a much more detailed description of, absence policies and things about that. And, there's certainly, in the unlikely event that and this does happen from time to time, someone gets a more prolonged illness and they do miss a substantial portion of the year, then we find a way to either, if it can be made up or if the person does need to restart. It's a very rare circumstance. But for the person who's out for, if you might be out for a day pending testing, for example, for COVID. But honestly, what the protocol is in the health system is individuals who had an exposure. Let's say I had exposure to a COVID positive patient, and I didn't have PPE appropriate PPE at the time. I would report that on the symptom tracker. That's one of the questions. The hotline would get in touch. Dr. Braddock, you better get a test. I'd go to get scheduled for my COVID testing, but then they'd say, you can continue to work if you wear a mask. And so the asymptomatic exposed individual is actually not banned from the clinical environment. So, but if I have symptoms, that's a different story. So then, depending on the duration of the symptoms, we'd figure out a way to make up the activities. Thanks. Who's next, Ashley?
Daylin is next.
Hi, Daylin.
Hi, good morning. Thank you everyone for doing this. I just wanted to know, because I know that usually anatomy labs we have access to it 24/7. Sometimes if we want to go back into it and study, would we still have access during this year, or would that change?
Yeah, so it's a good question. I'm actually going to broaden it a little bit because a few folks have asked about accessibility to a variety of spaces, including study spaces and such. And so the caveat to what I said about working with various officials around the things that we can allow students to come for essential instruction. The flip side of that is there are a lot of things that we're not allowed to have people on campus for. So, for example, we're not allowed to have students on campus to come to study in the study spaces we have around campus. So, unfortunately, we're not allowed to do that. We are discussing anatomy and some simulation practice. There's some discrete activities that we have in the curriculum where ordinarily you would have a chance to come back in and practice. Another example is we have when you're learning about the eye exam, we have an eye exam simulator that the faculty that lead that in the past have made it available for off-hours practice. We're not really ready to commit to say that we can do that because we need to have in place some monitoring to make sure that the appropriate protective measures were in place, that there's appropriate physical distancing. So at this point, the answer would be no, but it's in a category of things that we're actually kind of working on right now. Who's next?
All right, the next one is Michelle. Michelle, I'm going to ask you to unmute.
Hi, Michelle.
Hi, Dr. Braddock. I just have a question, and I'm not sure if this is the correct space to ask, but let's say you do catch COVID and you are symptomatic and you're staying at university housing. How exactly is that going to go?
Yeah, that's a great question. I mean, I know that obviously the housing officials will have policies on that. What we've heard from campus, and again, I don't know if I'm looking at Brandon Susselman, who's one of our key contacts with housing, if you've heard anything, or if others have heard from the campus more generally about plans to be able to have the person during a period of illness be in a single occupancy kind of setting. I haven't heard anything specific recently on that. Brandon, have you heard anything on that? No,
I haven't.
Yeah, so I've heard from campus task force that if a student were in a single, they could self-quarantine in their single, but there will be dormitories on, what's called the Hill, the undergraduate dormitory spaces for individuals to quarantine in a single room if needed.
Great. Who's next? Ashley, do we have another question?
Leanne, go ahead.
Hi, thank you so much for taking time to meet with us. I wanted to get some clarification. So myself and some of my fellow classmates are members of high-risk populations. So I wanted to know what extra precautions and accommodations the School of Medicine will be putting in place to protect people like me and those who live with high-risk individuals.
Sure, and what I would say is that any student who, related to COVID or for any other reasons, believes that you have a condition that warrants some accommodation to your educational activities, whether they be around this or around any other kind of condition, we have a office called the Center for Accessible Education that we would refer you to, and they would work with you and your treating physician to make sure that put together a set of recommended accommodations, and they provide those to the school. And then as a matter of our compliance with the Americans with Disabilities Act, we always work to provide whatever reasonable accommodations are requested. Does that answer? Leanne, does that address your question?
I guess sort of. As an undergraduate at UCLA, I have experience with the Center for Accessible Education, and I didn't often feel like their ability to directly influence my educational experience was truly their discretion, because there were larger school or department policies that impacted them. So I don't feel extremely comfortable putting all my eggs in their basket. because in the past it has not assisted me in any way.
Okay, well, I'm sorry to hear that you've had that experience. We certainly can talk offline about how to talk about your own experience with that. We do have confidence in the process of really trying to make sure that we're doing a robust assessment of what a person's educational needs are in light of any medical condition they'd have. The second thing I would say, of course, to any student who's not comfortable with whatever degree of risk, obviously you need to make the choices you need to make, and we support that. You have to work it through with you individually. So maybe we should talk about that offline.
Can I just make one other comment, Dr. Braddock, is that, you are all assigned to society deans in the Student Affairs Office. So I do think that you're in a supported environment in which you're going to have an advocate, even working with an office that in the past you didn't feel had that reach. I think that the Student Affairs Office works closely with all of the students through the society. So you would have just like people have patient navigators in the health system, you would have a navigator in the school for working with that office. So I think there is support there.
Dr. Miller, would you like to add anything to that?
Yeah, I was just going to just say something very similar to Dr. Martin. I think it's so helpful to chat about this, Leanne, on an individual basis and navigate the circumstances and help you to navigate as an advocate. But the society deans would be a great start.
All right, Annette, you can go ahead next.
Hi, Annette.
Hi again.
Annette, I see your hand is up.
Yeah.
Go for
Can
it.
I go? Okay.
Yeah, go for it.
Hi. I just had a question. So as far as our getting testing before we start school, a lot of us, we got testing last week, which will then be 4 weeks before we even are on campus. Will there be more testing before we start, or is there availability of more testing? Because when I called the ASH Center, I think you have to have symptoms maybe to get tested. So that was another one of my questions is, will we be required, or can we get another test before we start?
Yeah, great question. I'll start. I know that Dean Martin is, as she said, as part of a campus-wide task force. She may have more intel. The testing that many of you underwent, and some of you are thinking, I didn't get tested. It's okay, not everybody got tested, but the campus has been exploring the role of testing incoming students, like incoming all students, and even proposals that are being considered about more regular testing. At this time, at this moment, like literally today, there is no concrete plan of whether there'll be repeat testing. Many campuses, not just University of California campuses, are looking at the role of regular testing as part of surveillance, either testing everyone regularly, which is a pretty big undertaking, or subsets of folks on campus. But at this time, there is no plan that I'm aware of for repeat testing, but I know that there's a group on campus actively discussing that. Dean Martin, do you have any other?
Yeah, I mean, you're right on target. And Annette, you're correct. Right now, the testing, you were all, there was the medical students were tested last week or the week before the incoming, but the rest of the testing at this moment is only for symptomatic individuals. But there are incredible activities going on, trying to develop very scalable, inexpensive testing to provide testing across the campus at low cost. And I just bring that up because some of you I know are really interested in research, and it really exemplifies some of the remarkable advances that have been made by our faculty and trainees and staff working to develop new types of testing. And I'll just add one quick thing, because it's another question that's come up that's related, and it has to do with the symptom tracker. So the symptom tracker is something that you have to do, and there have been questions about whether medical students have to do it every day, whether or not they are on campus. And and the answer is yes. You take that symptom tracker every single day. once you're here.
Yeah, thank you for that reminder. Like I said, I was on service in May. I haven't been actually. I've been in the office a couple of times, but I just do it every day. It just becomes a routine. It takes literally less than a minute to do, so it's not onerous. Who's our next question from, Ashley? Or Brandon, or whoever.
All right, it's Max.
Okay, hi Max.
Sorry, everyone. I'm having some internet connectivity issues. So
we've all been there.
Hi, can you hear me?
Yes.
Hi, everybody. Thank you for having this today. My question was, given that there's other states and even counties that have significantly less cases and death rates across the U.S., for instance, like Boston, Massachusetts, and their schools have figured out ways to go full online for first year. I'm just wondering, can you speak to the additional limitations that UCLA faced, or any additional hurdles that caused the school to not be able to do this?
Sure. Well, I'll start and I'll let others add. And certainly, I respect leaders at other schools for how they've structured their program. What we've done is we've had a serious, deep conversation with all the faculty that are involved in instruction in our medical school, and the importance that we place in developing this, not just the knowledge, but the skills necessary to become future physicians. And part of that is the importance of hands-on education for those things that are essential skills to become a physician. Reasonable people may disagree what those are, but we're of the belief that there are skills that simply cannot be replicated remotely. Now, not to take maybe obvious examples, but if I'm training someone to be a surgeon, they have to be in a location, understanding the anatomy, normal and abnormal anatomy. You cannot teach surgery remotely. Now, obviously, as first-year students, you're not doing surgery, but your experience in anatomy is the beginning of that. And while there are great models for digital anatomy and other things, just to echo Dr. Napolitano, there is nothing that replaces being able to see in 3D in life and put your hands on the components of the human anatomy to learn. Actually, I think Dr. Elena Stark is on, who is our leader of anatomy, who may want to comment. Now, again, I would, certainly, if your question is, what's different about us, maybe it's just different. We have a different view of the importance of that, but we are, it's not that we're facing any barriers to going online. We have lots of stuff online. We've made the decision as a school that this is an important, essential part of your education. And as such, we've put it in place in a way that is as safe as when you take care of patients. So when you take care of patients, you could also argue, and we did this actually in a number of clinical areas, certain clinics that where it wasn't as essential were closed early in the COVID, and now they're open. They're practicing physical distancing and PPE and other things to be able to take care of patients. And so my answer back would be, I respect those who might disagree, but we believe that there are essential activities that are essential to training you to become a physician. And those are the things and the only things that we will be doing in person. Dr. Stark, I don't know if you want to comment about anatomy, or Dr. Napolitano want to add anything?
Yes, I agree completely with you, Dr. Braddock. And just very quickly, as I will add that the students themselves want to come back to the anatomy lab. Just anecdotally, yesterday we opened 20 sessions for the second-year students to come and look at the anatomy of the musculoskeletal system that they had to miss back in March. And the sessions filled up in like a half hour. So, and those were 20 lab sessions. Now I'm looking gladly into adding 10 or 15 more sessions. So I think that the students realized how important it is, and they want to. This is a voluntary activity. They already passed the exam, but they want to come to the lab and actually see the structures as you described. So there's also a lot of student enthusiasm and understanding that that's the way to learn the anatomy.
And I'll add to that, we pulled students out of anatomy lab for, towards the end of last year when COVID was just starting and we didn't have the right testing, we didn't have the science yet, we didn't have the comfort level that we have and the protocols that we have now. And definitely we're getting feedback from those students that say, oh, the online, models and 3D models are great, but it just doesn't sink in the same way as when we get to spend time in the anatomy lab.
And I might add that also we didn't have the necessary enough personal protective equipment, which we've worked incredibly hard, and actually thanks to many of the medical students to put in place.
Oh yeah, and we have been working very hard with the Dean's office to make sure that we will follow the rules when we are in the anatomy lab, which again, back in March, we didn't know what the guidelines were for safety, but now we do, and we will implement those to the T.
Okay, great. Who has our next question?
It's Theo.
Hey,
Theo, go ahead and ask your question.
Hey, everybody. So my question is it was actually from another student, but if someone were to test positive and we realized that they had attended anatomy lab in the past, what's the protocol there? Will everyone in that session be asked to self-quarantine and get tested again, or how will that work?
So what would happen is that the two things would happen. One is that the individual who is positive would, of course, that would be reported through student health. They would do contact tracing. They would contact each of the persons, not just in anatomy lab, but anywhere else, their roommates or their whatever, and talk to them about their exposure, assess their symptoms, make recommendations to them as to whether or not they would be tested. The mere exposure to someone who is positive does not equate to quarantine. That's probably the most important take home. I think a lot of people think that if you get exposed, you have to go into quarantine. Certainly there are times where people choose to go into quarantine before they're going to go visit their grandparents or whatever, or things of that nature, but it's not requirement you go into quarantine. There's symptom monitoring and there's COVID testing are the primary tools that we use to assess risk and to advise people what they would do. So that's what would happen. The second way that would happen is that if you were one of the exposed, would say, oh, I heard that, Clarence was in our anatomy group and he called me last night and said he tested positive for COVID. So on my symptom tracker, one of the questions is, have you been in contact with anyone COVID positive? So you would hit that and you would be contacted by someone to talk to you about your risk and advise you on what you should do. So I hope that answers, but the main thing is you don't have to decide yourself or figure out what you need to do. You don't have to decide that. We have a system in place to advise you based on whatever it is, your symptoms, exposure, and this is why it's so vital that every day you do the symptom tracker, because that allows us to have the information from you to advise you, so all of you don't have to try and figure out, you're going to be in the grocery store and somebody's coughing and you're going to be, all of these kinds of things will happen, and the symptom tracker is our primary tool supported by symptomatic testing to help manage it for you.
I just wanted to add one more comment for perspective. In the hospital setting, our group, the hospital medicine group, takes care of people that are sick with COVID on the floors, not the ICU patients, but on the floors. And I'll tell you that the personal protective equipment that they wear into the room to take care of people that are actively ill with COVID is the same equipment that you'll be wearing in the anatomy lab. And knock on wood, we've been fortunate. Nobody, that wears that equipment and takes care of people with high levels of COVID or high viral burdens of COVID has become, sick from that. So I think that gives me, some comfort to think about that.
Yeah, it's a great point. I'd say that, the other thing is that if you go kind of zoom out to what's the public health rationale for masking, it's that at the end of, we all know that the COVID is an unusual virus in the sense that a large percentage of individuals who are infected are asymptomatic. And then there's sort of, for people who are going to develop symptoms, is a rather long, several-day pre-symptomatic phase of infectivity. So masking dramatically reduces droplet transmission from the infected individual. So I've always, say this to, friends and other, sort of social contacts, that when you're wearing a mask, you're protecting others from you. but you're also protecting you from others. So, I mean, it's I'll confess, one of my frustrations with the recent rise in cases, I'm not alone in this, is that largely it's a result of people not wearing masks and people not practicing physical distancing. And many public health officials would say if only everyone would wear a mask all the time and practice physical distancing, COVID cases would plummet. So that's the underscore to say that the protective measures that we're providing to you in the modest amount of in-person activities, mandatory masking and a face shield, plus all the other things that are part of the protocol, will protect you as much as they protect a healthcare worker taking care of a patient known to have COVID. Who's next? Samantha?
All right, we've got 2 more questions. The first is from Samantha.
You're not yet unmuted. Okay, there you go.
Thank you guys for super helpful. Wondering 2 things. First of all, are any of the student-run clinics going to be happening? And if so, can we participate during this time? And then also, I'm wondering if you guys know our in-person things that we're doing weekly, if we know when, like what days those will be yet, and are those going to be the same every week?
Sure, yeah. So on your second question first, so the student-run homeless clinic and the mobile clinic have been long-standing student-run activities to provide healthcare services to very vulnerable members of our community, and those are activities that are ongoing, and they are very much will be a vital part of the overall so-called early authentic clinical experience. That will start in September, and it is slated to start. Again, the same principles of protective equipment will pertain there, exactly the same as you would in any other clinical environment. And again, the rationale is that you're part of a team providing healthcare services to people in need of them, and as such, it's considered essential. But you'll have and we're working with each of those to make sure that each of those entities to make sure they have adequate personal protective equipment. And if they don't have adequate PPE, then you won't go. But all are in place to have adequate PPE. And I'll look to Dr. Napolitano for the fine detail on this, but the first in-person activity that you will participate will be the second week of August, week of August 10th. Typically, Tuesday, Wednesday, Thursday afternoon, there's a rather complex where you're kind of in thirds of people doing either some things will be done remote, such as small group discussions and so-called doctoring, anatomy lab, eventually early authentic clinical experience and such. So it's usually, Jason, it's usually Tuesday, Wednesday, Thursday afternoon.
Correct. And for things like clinical skills, if you're a Tuesday clinical skills, your first session will be Tuesday, second session Tuesday. So there will be a general pattern to which afternoons you have which labs or which clinical skills sessions. If we haven't released those small groups yet, they'll be coming soon. We've been, the curricular affairs team has been putting them together for both the first years and the second years this week.
Let's do one more question. I just realized we're at our time, but we'll fit in one more question.
All right, Liz.
Hi, everyone.
Hi, Liz.
So my question is around the in-person activities and for the students who choose not to come onto campus because either they're immunocompromised or, whatever that decision may be. How are we preparing to address the inequities in the education that will result from that? And I know, I'm not immunocompromised, but even just as a personal choice, I don't feel very comfortable coming in for in-person activities. And I don't know, I'm concerned about how that will impact my education in the long run.
Well, I would appreciate the question. I would start by saying that anyone on this call or anyone that you know on this call who has a situation where you still, despite what we've talked about and such, have deep concerns, we should chat and figure out what's the right path forward for you. And of course, we will respect whatever you decide, and we'll do what we can to create either through formal accommodations or through what we can a path forward. And there may be individuals who decide that this is not the right time to start medical school. I can tell you that in the run up to this, there have been a few folks who have considered deferring for a year, and at least one person that did decide for a complex set of circumstances to defer for a year. So that you have obviously complete agency to decide, and what you're comfortable doing, what you're doing, what you're going to do, and we would respect that. I think what we're trying to communicate as best we can is that we have approached this in a careful, thoughtful way. We are, entering into training you as physicians, and we believe that just as in the same way that Dr. Napolitano and I talk about how we get comfortable going into the clinical environment, we want to make it so you can feel comfortable coming into the learning environment. Now, in the clinical environment, there are individuals when COVID started that did not feel comfortable either because they themselves or family members had conditions where they felt undue level of risk, and that too was respected. So we want you to hear that we want to respect your agency to make the right personal choice for you, but if you're but at the same time trying to provide for you enough of a sense of what we've done to make this as safe as possible. I mean, in the big picture, and I've said this many times in other parts of my own career, I think back to when I first started training was the very early parts of the HIV/AIDS epidemic. And, you sort of realize as a physician that there's a sort of non-zero risk, personal risk, that we take as physicians. And, that's a very personal choice to decide to take that on. And I don't think any of us takes it on lightly, but it is a choice. And, what we ask as clinicians of our healthcare system is to take all the appropriate and evidence-based measures, precautions that are necessary for us to do that with minimal risk. And we realize the risk is not zero. Not to make myself sound old, but back in the day, medical students were drawing blood, went around every morning, drew blood on all the patients. We didn't wear gloves when we drew blood on all the patients. That would never happen today because we realize that that's not a prudent practice. But there are still people drawing blood, and they're trained phlebotomists who use the appropriate universal precautions, and they don't use needles anymore. There's all these different precautions in place. The risk is still not zero for a phlebotomist to get a needle stick, and every year phlebotomists get needle sticks, nurses get needle sticks, doctors get needle sticks. So I mean, in the big picture, each of us you really should reflect on the level of risk that you're comfortable with. The harsh reality, we enter into a profession where that risk is not zero. We should demand from one another that we do everything to reduce that risk to an acceptable level. But honestly, I want you to hear from us that we respect that these are very extraordinary times, and you're entering into a profession in an area that is new, and we want you to feel as comfortable as you can feel. But if that's not enough, we should talk. And I'd be happy to chat with you more about that if you'd like to. Sorry for the long answer.
Can I make two quick announcements before we wrap up?
Yeah.
I just wanted to remind all the students, you've already received information, and I'll be sending a reminder, but on Monday we have representatives from the Ash Center to come and talk about student health insurance and immunization requirements and any other questions you have for the Student Health Center. So that's Monday at 2. And also, I've been sending out reminders about getting your computers encrypted, and we're hoping that everybody takes care of that before the first day of school. So if you have any questions on that, please check in with the IT Connect folks.
Thanks, Brandon. I apologize for going over time, but I want to thank the dean, the associate deans, really everyone on the call from our team for being here. I want to thank all the students for your great questions. We're excited about you starting. I would just reiterate that if any of you have things we haven't talked about today on this call, or you still have residual things you'd like to talk to, you all know how to get in touch with me because I've chatted with many of you. But now I think moving forward, Dr. Miller or the assistant deans we're at your disposal to chat and talk through things, whatever the issues might be, to get you off to really exciting launch to your medical career. So with that, I'll say goodbye and we'll sign off. See you soon.